Okay, my project is on Treacher syndrome, which is a genetic birth defect that affects the development of bones and tissues of the face. So this disorder is characterized by craniofacial anomalies that can affect the eyes, ears, cheeks, palate, and jaw. All patients with this disorder have similar observable traits, but their traits can range from severe to mild. So this condition is significant in healthcare. I've actually seen one patient with this at my work at Primary Children's Hospital. It's significant because it does affect people, and it really does affect their lives. It's rare, so it affects 1 in 50,000 people, but those who are affected, it can really affect them. In severe cases, the underdevelopment of their facial bones can restrict their airway, causing potentially life-threatening respiratory problems. Hearing loss can also occur, and does in about half of those who are affected with this disorder. So it's a rare genetic disorder and thus calls for more research in healthcare. It is important to understand the disorder, how it happens, and if it's preventable or detectable earlier on, and what we can do to further treat it and improve the lives of those who have it. So it's definitely detrimental to the patient or to the child who has the disorder, because as previously stated, it causes mild to severe craniofacial abnormalities, which can lead to breathing problems, feeding and swallowing problems, and hearing loss. It can also cause learning problems if they have the hearing loss or deafness. Thankfully, it doesn't affect their brain, so it is not technically affecting their intelligence, but the repercussions of having hearing loss or these other issues can definitely affect their development and intelligence. So all these complications of the disorder are significant and have a large impact on the child's life. But not only are there the structural issues that lead to health complications, but also psychosocial issues from the genetic disorder due to the way they look. They look different, and they have these, their faces just looks different than everyone else's, and so people who have this disorder can struggle with low self-esteem and depression caused by the social stigma due to their altered appearance. So rarely it's diagnosed before the child is born, if it's detectable on an ultrasound, but typically the syndrome is diagnosed after birth based on examination, possibly X-ray or CT scan. So there are a lot of surgical options for this condition depending on how the child is affected. So these surgical options include reconstruction of lower eyelids, cleft palate repair, repair of absent facial bones, ear reconstruction, repositioning of the lower jaw, and rhinoplasty. Hearing aids are also an issue, or a solution for the issue of hearing loss if that occurs. Further, speech therapy helps improving the child's communication skills and possible swallowing or feeding difficulties. And dental work is an option if the child requires a bite correction. Finally, some newborns may need special positioning or tracheostomy placed in order to protect their airway if their facial abnormalities are such that their airway is threatened and they might not be able to breathe on their own. So in conclusion, this is definitely a significant genetic disorder that affects people. It's rare, but the people that it does affect, it really does have an impact on their life. And so that calls for more research in healthcare on how to hopefully detect it sooner. It would be great if we could learn how to prevent it. And then just further how we can treat these patients and make their lives as easy and normal as possible. So that is my presentation.